Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. SOFA and the qSOFA or the qSOFA scores. So before we get here, we need to know about sepsis. So the sepsis is defined as a life-threatening organ dysfunction. So it is a life-threatening organ dysfunction. So it involves the organ and it results in the dysfunction. So this is due to an unregulated host immune response to infection. This is due to the host immune response to the infection. And to define the beginning of organ dysfunction, so for the beginning of the organ dysfunction, so for this case the SOFA is used. So what does the SOFA score stand for? It means there is a sequential organ failure. The sequential organ failure assessment scoring. So in short, it is known as the SOFA. So first we need to know what are the components of the SOFA score. So when you're looking at the SOFA score, the components it includes, there is circulation. So circulation, it can include the systolic BP. There is a systolic BP and there is a need for vasopressors and the platelets. Circulation includes systolic BP, need for vasopressors as well as the platelet count. Next component will include the respiration. So respiration, it includes the PaO2 as well as the FiO2 and for need for the mechanical ventilation. A need for mechanical ventilation. Next is we move on to the mentation. So in the mentation we have the GCS, that is a Glasgow Coma Score. Glasgow Coma Score. Next there is hepatic function. The hepatic function. So in hepatic function we look for the bilirubin. And moving on to the renal function, we look for the creatinine. So now let's look at the qSOFA score. So we have gradings from 0 to 4. So gradings, it goes from 0 to 4. And now specifically let's start with the cardiovascular. In terms of the cardiovascular, in score 0, it is there is no hypertension. Next, when you look at the score 1, there is MAP or less than 70 mmHg. Next, when you're looking at score 2, it is going to be the dopamine. It is a dopamine which is less than equal to 5 or the epi or the norepinephrine. This is less than equal to 0.1. Now moving on to the dopamine, the third variety. So here the dopamine is greater than 5 or the epi or the norepi. This is going to be less than equal to 0.1. Next we move on to the fourth variety. So in score 4, the dopamine, it is going to be greater than 15 or the epi or the norepi. This will be greater than 0.1. Now let's move on to the coagulation. So here in coagulation, they look for the platelets. So these platelets, it is into 10 to the power 3 per microliter. So in terms of 0, it is going to be greater than 150. In terms of 1, it will be less than equal to 150. The 2 score is going to be less than equal to 100. And in terms of 3, it will be greater less than 50. And 4 means it is less than 20. Now let's move on to the respiration. So here in respiration, the unit is going to be PaO2 or the FiO2, and this is nothing but in mmHg. So 0 means it is less than 400. Next, let's look at 1. 1 means it is less than equal to 400, and 2 means it is less than equal to 300. Next is 3. 3 indicates it is less than equal to 200, and there is presence of the respiratory support. And what is 4? 4 indicates there is less than equal to 100, and this is again with the respiratory support. Next we move on to the mentation. So in terms of mentation, it is the GCS, and here we have scores 0 to 4. So 0 means it is 15, 1 stands for 13 to 14. Next, looking at 10, 10 to 12, this is for the grade 2 is 10 to 12. Then 3 stands for 6 to 9. Lastly, the grade 4, it will be standing for less than 6. Now let's move on to the liver. So in terms of liver, it is the bilirubin. So bilirubin, the unit being millimole per liter. So here in 0, it is less than 20. In terms of 1, it is 20 to 32. Next, in terms of 2, it is 33 to 101. Next, we move on to 3. 3 indicates 102 to 204, and 4 indicates greater than 204. Next, we move on to the kidney. So here in kidney, it is nothing but in creatinine. It is in creatinine, and this will be in millimole per liter or the urine output. So in terms of the grade 0, it is going to show less than 110, and 1 means it is 110 to 170. 2 indicates it is 171 to 299. Then moving on to grade 3, it is going to include 300 to 440 or less than 500 ml per day. Now moving on to grade 4, it is going to be greater than 440 or less than 200 ml per day. Now let's move on to the organ dysfunction. So in terms of the organ dysfunction, so here what is the identified as a SOFA score? So the SOFA score of greater than equal to 2 means it is organ dysfunction. So there is a simplified version recommended by sepsis 3. So it is known as a quick sepsis related organ dysfunction. So there is the qSOFA. So what does it include? This includes the systolic BP. The systolic BP less than equal to 100 mmHg. Then is the respiratory rate. This is greater than equal to 22 per minute. Next is the altered mentation or sensorium. There is altered mentation or the sensorium. So each criteria it contains 1 point. Each criteria it contains 1 point. Next is the qSOFA score of greater than equal to 2 is associated with increased mortality. So in case a qSOFA score is greater than or equal to 2, it indicates the increased mortality. Now let's compare the SOFA versus the qSOFA score. So SOFA versus qSOFA. So here we need to know that the SOFA score, it is more comprehensive and accurate. So it is comprehensive as well as it is accurate scoring system that is particularly superior to the, so it is greater than the qSOFA score. It is superior to the qSOFA score in case of a ICU setting, in terms of a ICU setting. So next is the qSOFA. So what is special here? The qSOFA is nothing but a simplified derivative of the SOFA score. It is a simplified derivative of the SOFA score, and it is used for bedside assessment, and it is used for the bedside assessment, and that is particularly useful for the outside the ICU settings. So it is basically for the outside ICU settings it is used. So example being, it can be used in the ward, it may be used in the emergency department, and next is the best description of sepsis. So what is the best description of sepsis? So suspected or documented infection. So it is nothing but a suspected or the documented infection, and this is going to be with the SOFA score. SOFA score that is greater than or equal to 2, or there may be a suspected or documented infection. There is a suspected or the documented infection, and this is nothing but with a qSOFA score. It is greater than or equal to 2. Other thing to note is the score, it is used as a predictive tool. So they were actually used as a predictive tool to calculate the risk of death from sepsis. So it was initially used as a predictive tool to calculate the death from sepsis, to calculate the death from the sepsis. To learn and grow daily like this, please do subscribe.